Hello, Connie. Thank you so much for joining with me today to discuss the very relevant and um, very painful to some issues relating to the healthcare industry in California and all around the US as they relate to vaccine mandates. I wanted to talk to you because you, besides being my former client, you kept in touch. I know you're very social, you're very involved in what's going on, you're very active. You have what, 30 years of experience in nursing?
Correct. Yes.
And you're still
Yes.
working as a nurse consultant. And also, based on what I know about you, you're a reasonable person. You're not extreme politically. You don't lean to a very extreme left or right. I'm sure you have your preferences, but I feel that with your experience and your personality, you will be the voice of reason. Do you think I'm correct?
That's very true, Arkady. You got
Okay.
that right. Yes. Thank you.
Okay. So I know you work remotely. You live in California. You work remotely for a hospital in Hawaii as a nurse consultant. Can you tell me what the general response is in the world of nursing to the vaccine mandates?
Yes. First of all, I would like to thank you so very much for this opportunity, actually, Arkady, so that I am hopeful that while we share that we could walk away with insights and suggestions as how we should resolve some of these issues, actually. And thank you so much. Quite complimentary about what you have shared with me, and I'm honored for the opportunity. Yes, I am a. I was hired as a nurse consultant with the Hawaii Training, Healthcare Training and Consultants, um, and because there are so many issues actually, and the healthcare department in Hawaii, by the president, Shoni Patricio, she did not mind me sharing that. She is the CEO and she knows me very well, and she asked me to be the consultant. We have been working with them actually. Especially during this time of pandemic, and we are really working very hard to see what we could do in training those students, because we are in fact successful in the theory part in training them, but what is lacking is, even if we graduate them, the lack is actually the hands-on skills. So that is one of the important area that we need to be focusing on. The other thing that I do actually is, during this pandemic, I was able to train and make a lecture. What you call that? Lesson plans as to what I could contribute to train the students, and I was able to do some research. Actually, what I see is causing, or how this pandemic is coming about, and the community response from the community, both California and Hawaii, is twofold. Actually, it's split. But when we talk about the healthcare of healthcare nurses, LVNs, and nurses aides, we are actually very, very overwhelmed. And that is one reason why they had asked me to be recalled from a retirement period. And I saw the need for that, and I am honored to go ahead and do that as a
So, Connie,
consultant.
let me interrupt you for a moment.
Yes.
My question, general response in the healthcare community to vaccine mandates. Can you talk about how people feel about the vaccine mandates?
Yes. Actually, the nurses, especially that I have talked to, they have shared with me exactly. One that I had talked to yesterday, as a matter of fact, is the nurse who works at ICU. A lot of them are really they do not like, they are not against the vaccine itself. What they are against is the mandate, because we feel, including myself, we feel that the vaccines is a right of choice. We have our personal choice, and so we also understand that vaccines are to save and prevent hospitalizations and any acute illnesses. So yes, they are against the mandate, especially now that more and more research is being done to show that actually the vaccines are not the answer. The mandate is not the answer to this. And first of all, the vaccines were rushed due to the rapid rate of death of people, that the Emergency Utilization Administration for these vaccines had to come about in trying to stop the rate of death. But now it is slowing down, and it should really not be mandated. As a matter of fact, very
Okay.
dangerous to do that.
That makes sense. And many nurses are willing to resign, meaning they feel that strongly. They're willing to resign not only from their job, but almost like from their career, because nurses in general are required to get vaccinated right now. What are they going to do? Where are they going to go?
Yes. Well, first of all, they are willing to resign because they see, when I'm in the floors and I take care of patients who have COVID, what they're seeing here is they are dying whether they had fully vaccinated or not. And if we are mandated to receive the vaccine, are we taking a chance and a risk whether to receive the vaccine, and they are telling us that, yeah, we will not be hospitalized even if we will be sick. It's not that, it's mild. That's not true. What when we see patients and family members just dying left and right without a say so, we are willing to resign because we will die there anyway. We are mandated like 48 hours at a time because there are lack of nurses working anymore. And we really do not have any adequate PPEs, the personal protective equipment. And that's another thing. And I see that even no matter what we are hollering about, let me put it this way: even the supervisors, their hands are tied. What can they do? It's either they lose their jobs also. So the answer to that is yes, we are willing to resign. And where we are going, as a matter of fact, is it's really very heartbreaking, and at the same time heartwarming too. I am starting or establishing a program where the nurses could come to this training, and we could actually, if only nurses could see their values, so that we don't have to work in a hospital setting. We could work in homes. Like we will have a training center, and then we are going out to patients' homes and we monitor their medications. And also, it seems like we are going to use whatever they have in their homes and train their family members to take care of their loved ones. And it seems like that is working because we are also teaching them what proper food to eat. Oops. Oh, what's that? And so a lot of us are going into that kind of instructions training, and nurses will be leading out in this. And if we could only find a way of financial support, I think that would be helpful. Well, excuse me. Can you hear me all right still?
Yes. Yes.
So a lot of us are going to farming. As a matter of fact, we love gardening and farming and sewing and cooking. And right now I have a group that, they come and we share recipes and we garden. That is what's going on at this time also. Where we are developing, we know that one of the answers to this is, proper nutrition. And a lot of folks go and buy their stuff, and we don't. We want to garden and make our own fruits.
Connie, there is a comment here from Gloria Miller. The COVID-19 vaccines have approximately 100 times more reports of death per year than the average reports for all other vaccines combined. I think she's citing certain statistics. We hear a lot of stories. One side tells people that vaccines are almost perfect. The other side lists thousands of adverse events and injuries and deaths. What's the truth from your own experience being in the trenches?
There are quite a bit of division of opinions about the vaccines. I think that, for example, the latest that happened with the Johnson and Johnson's vaccine that had caused quite a bit of, I believe it's 6 young people have myocarditis out of that, and then it's really very confusing. But see, the thing is, again, we do not have any against vaccine, but it's the mandate. I believe that it should be individualized assessment between the nurse and the doctor, and because we know what we've got, we know our bodies, we know what's happening in our health, family health history, and so forth. So it is very stressful actually to mandate us and without any recourse. So that is where we are.
So what is your response to people who say, look, you work in a hospital, you work with vulnerable, sick people. We have to do whatever we can in our power to protect the patients, whether in the hospital, whether in nursing homes. Why shouldn't we mandate vaccines specifically for this profession?
Well, again, that is really taking a very big risk. It is very much individualized to the nurse. Some of the nurses have taken the vaccine, and some of the nurses did not, because again, they know their body chemistry, and also they have experience. It is so easy. It is so easy to say mandate everyone, especially in the healthcare. But when you are looking at people who are dying, whether they were vaccinated or not, you have to take a risk, because what we are seeing is is real. We cannot ignore people who are dying that we are taking care of. And so that is one reason why some of them and most of them are resigning. Yes, we have taken an oath actually to save and make sure that we do no harm to anyone, including especially our patients. Um, so it, it is that is my comment there is really actually it should be individualized. It's between the nurse and the physician. Nurses are people too. They become patients, you
Right.
know. So it's so
Do you
easy.
think you don't have the?
Go ahead.
I know the statistics, but how many nurses do you think agree with you? Are you in a majority or are you a minority?
I am actually right in the middle, a little lesser in the minority, because again, the nurses are looking at what they can do. Will they continue to have a job? Will they continue to have income for their family and loved ones? And they sacrifice a lot. They're sacrificing a lot. We even do not mind having a test every week, whether we are positive or negative, so that when we are positive, what happens is that we can go ahead and be quarantined and get some treatment. But to say that you are to go to get the vaccine, whether you like it or not, it's not right. We have our individual rights, actually. And some of the nurses actually are also very spiritual people. They know that the vaccines are not going to save them, whether they take the vaccines or not. They know that they have natural immunity. Most of the nurses, by the way, who are exposed to the COVID-19, they have the autobodies in their system. They have the natural immunity. Some are strong immunity system, and some are still weak, and they know that. We know when we are sick, so we have to also individualize that idea.
And you're bringing up a great point about testing. I've heard this very rational observation that we know that if you're vaccinated, it doesn't mean you cannot get infected or transmit. So you should still be tested whether you're vaccinated or not.
Right.
So the most sure way to know whether someone is a risk for someone else is a frequent testing, whether or not you're vaccinated, right?
Correct. Yes.
So places that say you if you get vaccinated, you don't need to get tested, that's wrong.
That's correct.
What do you think? Yep.
The other thing that comes to mind is if these vaccines are effective and safe, why do you have to mandate?
Everybody's asking. Yes, it's because, well, it's probably because they know, and now we know they're not quite as effective. And instead of saying, you know what, instead of being truthful and honest and saying, you know what, we know now that vaccines are not as good as we were hoping they would be. It took time for us to realize it. This is happening not because we misled you or we deceived you. We are learning with you. The government learns with everybody else how good the vaccines are. Instead of saying that, now they're gaslighting and they're shifting blame on the people who do not want to be forced to be vaccinated, right?
Yes, that's correct.
What else do you think the government is missing, or the people who are in charge? What else are they missing that they could do better? Or whether it's through intentional misrepresentation or whether through some kind of negligence or some kind of oversight?
It is much more powerful and it is much more honorable for the government to recognize when they do wrong, when they make a mistake. and look at, actually, if we're talking about the focus on the healthcare arena, this actually, the topic of this vaccine and what the effects of it and the health of all workers and the patients equally, it should go back to the healthcare arena for decisions, for alternatives, and the government should really support that. If the government will neglect the healthcare at all because of what they believe in, without even considering what others or other people are saying, what happens is your healthcare will fall. And guess what? This government are people who will get sick. They're not exempted. They're not exempted to this. They will get sick. They will get older, and they will get sick. And it's a power struggle right now, and it's sad to see that. So that is my plea to the government, actually, to look at who is supposed to be making these decisions when it comes to the healthcare of people, and including themselves. And it's not equitable, Arcady.
Okay. Where do you think is this going? What's in the future for us in terms of mandates, vaccine mandates in the healthcare industry? Where do you think it will end up?
I believe that it will really actually it will go back to the very individual. Nobody wants to die because of mandate. We can survive without being mandated. We can survive without working in the hospital setting. Just like I said, what some of the nurses actually are doing is establishing a network wherein we will be helping one another as nurses. And I'm beginning that, and I'm looking forward to move on with that movement.
I think it's amazing that the nurses that have been working in ICUs for over a year with COVID patients, the nurses that are seeing people who are sick and who are dying, who are on ventilators, who are suffocating, they see the before their eyes, and many of them are against vaccine mandates. Many of them are willing to walk off the job rather than be subject to vaccine mandates. So if they make that choice, you would think that everybody else would stop and wonder, why are they making this choice? They're in a better position to talk about it than anyone else.
That's correct. That is true.
One more thing I wanted to talk to you about today is I want to go back to the issue of side effects. I know that whatever you will tell me is not going to be a conspiracy theory. It's not going to be political. It's not going to be, something untrustworthy. So have you, with your own eyes or with your own ears, heard of serious side effects or deaths that were clearly caused by someone getting vaccinated?
Yes.
Can you talk about it a little bit?
Sure. It is very, very sad. Well, let me explain it this way. I know for a fact couples, and I don't have to mention their names. What happens is that the couple got sick, and they were elderlies, and of course they were in a hospital. They were hospitalized, and unfortunately, nobody is even considering that there are comorbidities. And so what happened is that when they were hospitalized, they were already tested. But before the test came, as a result, they died. But because of fear of of whoever is running the hospital, they were buried. They were buried. And then the test came out negative. So how are we supposed to feel about these things? How?
Terrible.
There are no, the thing is, we immediately believe that it is COVID. There are no actual data that a patient died. How could it be that everyone so far that comes into the hospital are cause of death is COVID? And that is not quite true. That is why I'm saying that I think that there should not be a mandate to this vaccine, because we don't know the long-term effect. We don't. What we see is the effect when people are dying and being diagnosed as COVID, and we see the effect of it. Compared to what we don't know, because we are unvaccinated, some of us, and we are doing okay, are we going to take the risk? But the questions, if we really see some symptoms from the people, oh my gosh, yeah, it's in our backyard, meaning it's around us anymore. People who have received the vaccines have died. People we know, people we care for. So the answer is, yeah, I will not. I can't. I cannot go and take risk. I would not. If I had a crystal ball and looking down on what is happening and see all these symptoms that are happening with these people, vaccinated or not, because we don't have a solid data on who got vaccinated and who didn't. What happens, I look at my crystal ball and I'm seeing all of these people dying anyway because they received the vaccine. I don't think I will go and take my risk to get the vaccine just so that I will have myocarditis. And I can't do that.
Connie, thank you for sharing this. Just to clarify, of course, there are people who die despite getting a vaccine from
Right.
COVID because they end up contracting, but there are also people who get injured from the vaccine.
Correct. Yes.
Right? So can you talk about people who get injured by the vaccine? Have you encountered any such cases? How common they are and how serious are they?
Some people reacted with allergic reaction. They may not have died, but they really took some awful allergic reaction. Let me just explain a little bit about what happened when there is a virus that spikes up. Look at what happened to the Delta variant. The Delta variant came about and was discovered in India. What happens is people got sick and they went to the hospital. The hospital was not ready to have equipments like oxygen. They do not have any oxygen. So what they used for this, the folks, were the industrial oxygen that is not medically graded oxygen. So they were pumped with this oxygen. They got better, I guess, and they went home in 2 weeks. In 2 weeks after that, they developed mold in their sinuses, which is eating the brain. It was eating their brain. All of them in the ICU died. Okay. There is a virus that spiked up so suddenly, so it was spread. So it became like, pandemic. So what are we saying here? The mode of transmission actually is airborne. And when you are with somebody close to you and they are inhaling and they happen to have the COVID virus, you will catch it or you may not. So what I'm saying here, it's actually the fear and lack of understanding about how this virus are transmitted and how they replicate. They replicate very fast, but they're also fragile. They do not last out in the air for too long. And I will be talking about that if we have time or in the future about how to self-care. And it is amazing that no one is looking at that. Instead of mandating the vaccine, why can't we really all look at how we could take care of ourselves and take care of others by training and educating them, including government? Why couldn't we do that? If we could just lower down our egos and pride and accept whatever it is that we are contributing to the community, I believe that we will have a healthier people, healthier citizens. And that's what I could say about that, Arkady.
For a long time, nothing has been said about self-care, early treatment, early prevention, the importance of sun, vitamin D, vitamin A, all kinds of therapeutics and antibiotics that are available that could alleviate the symptoms. I hear that it was a big mistake to just send people home and tell them come to the hospital when you're feeling really, really sick and when it was very late. So it's one of the things that were done, let's say, incorrectly throughout this period. And it's very sad because in other countries, even in Mexico, and we know in India now, they learn from their mistakes, they implement certain changes and they achieve results. But we don't like to admit mistakes. We like to stick to our own ways, no matter what.
Well, actually, I welcome mistakes. But that is supposed to be how we learn. But the pride and the not allowing to learn from mistakes is where it's wrong. Because yes, you're right. There are other alternatives that we could do aside from mandating. We could definitely go around, and that's what we are trying to build now. We are going to try and train family members to take care of themselves. How could we not? I mean, I have known many nurses actually who have strong immune system because they research and they know what's going on. You cannot go and take care of sick patients without being healthy. And that is one thing that I really admire and advocate for nurses, especially the older ones, because they've been there. And that is one reason why they're trying to mentor the young. And I really appreciate that profession.
Now, you mentioned religion earlier. I can imagine that there are nurses, especially nurses of Catholic religion, the ones maybe who come from the Philippines. They have this God-fearing attitude where they're not afraid, first of all, as much as other people, because they are generally only afraid of God. They think God will figure out the best way for them. And does it come into the equation? So, in other words, did you notice that religious nurses who are maybe more close to Catholicism, they are less afraid of getting sick, and therefore they're even more against the vaccine mandates because they simply don't have as much fear?
Well, that's in a way that's correct because they believe that they have a maker. Vaccines or any kind of illness did not create them. They know that there is one God who is in control of everything. I have seen that, as a matter of fact, God also, oh, well, let me backtrack a little bit. I know that some of the nursing schools, one of where I came from, that we have a chapel there. And what happens is all denominations go there in that chapel and pray for guidance and directions before we even go to our units. And that is very, very helpful, because then you have the focus actually not mixed in with any self, the me, and we do take care of our patients really well. But to answer that, yes, they also recognize that no one else should really dictate one's health, one's decision in terms of healthcare decisions and treatment and so forth. So that, yes, very strong indeed.
Well, Connie, thank you so much for sharing your thoughts and your knowledge and your observations. And we will talk soon. And I will stop the recording right now.